Bob, I think you can buy a golf cart cheaper than that.
Yeah. Definitely can. I have one.
I'm guessing yours is not pink.
Mine is not pink.
Oh man, mine is pink and it goes really good. Pink is aerodynamic.
Yeah. Is that why all the people at the festival for the county always turn sideways when they seen you come by looking for riders?
I think so.
They were waiting for the next golf cart.
Okay, can we start? Who's not here? John?
Commissioner Snyder is still trying to get connected. Kathy was speaking with him a little bit ago, so
Well,
you want to wait or you want to get started?
let's start. When he gets hooked up, we'll bring him in. All right, we'll call the Ways and Means Committee to order. And Kathy, are you doing the roll call?
It's helping John.
Oh, I don't know. I was thinking another Kathy. Yeah, we can
Commissioner
wait.
Foster,
Here.
Commissioner Hubby Wright,
Here.
Chairman Hughes,
Here.
Chairman Hughes,
I'm here.
Commissioner Laring,
Here.
Commissioner Mahoney,
And you're muted.
I'm here.
Commissioner Nash,
Here.
Commissioner Snyder, Commissioner Wilkins, Commissioner Skolnick.
Here. We've got a quorum. So we'll move ahead to the approval of the minutes of November 5th that were in your agenda packet.
I'll move.
Support.
All right, we've got a motion and it's been supported to approve the minutes of November 5th. Are there any comments or corrections or anything anyone would like to bring up on that, on the minutes? If not, we'll vote. Kathy, roll call. I'm going to do a roll call on everything.
Commissioner Wilkins, Commissioner Foster,
Yes.
Commissioner Hubby Wright,
Yes.
Chairman Hughes,
Yes.
Commissioner Laring,
Yes.
Commissioner Mahoney,
Yes.
Commissioner Nash,
Yes.
Commissioner Skolnick.
Yes. Okay, so the minutes are approved. I don't know if there's 26 people on the call. We have time now for public comment on an agenda item. So if there's anyone in the public among the 26 people that are online, you can, is there a button there to raise your hand?
Bob, I don't see any hands raised, but
I'm looking through the participants. I don't see any either. Okay, we'll move on. There's no public comment. The next item is the budget report that was in the community, that was attached, is just a informational item for now. Beth, do you want to make a comment on that? Beth, you're muted, I think.
Nope, I shouldn't be.
Okay, thank you.
Can you hear me?
Yeah, we can hear you now.
Okay. Yeah, I'll make a brief comment. The budget report is for the month of September. It is very preliminary at this point. We are still in the process of closing fiscal 20 year end. So the results are not completely final. The general fund is at this point looking better than what we had anticipated, but there are still more entries that need to be made, possibly some more invoices related to last year that may still be coming through. And then the big thing that we have left is for the funds that receive a general fund appropriation, we need to go through the process of closing those funds out. So it's still not close to being final, but I wanted to provide you with the results as of this report was ran on the 9th. So
Okay,
we will-
Beth, so as of right this minute, and I know it's not final, it's like right now, there's a surplus.
correct. But again, we have several entries that have not come through yet that we're still working on. And there are potential invoices that may still have not been processed, but we're hoping to get those in either this week or next week at the latest. And then we have to go through the process of closing out all of the departments that receive a general fund appropriation to make sure that, if there's additional transfers there that are required or less, that we get those processed. So we're still not there yet. We normally don't, the audit doesn't even begin until January.
Yeah.
And so there's still a ways to go.
So can we vote and call this good?
I just have a question or two.
Sure.
Okay,
On page 8, Lake Pollution Control Fund, we only spent 500 of 5 million. What department handles that? And what would be the reason?
So let me look at it real quick here.
Page 8, the second item, Fund 2240.
Okay, so that is the fund that was created for the cleanup of
that's the
$1,000 grant that we received for the cleanup of Windward Point. So
Oh, I see. Okay.
Marcia,
Public
you asked about that at the last meeting, I think. That's the actual fund right there.
yeah, so Public Works is the one that's responsible for that fund in terms of processing the payments and so forth.
Okay.
Okay,
And then there were a number of drains that had negative balances. About
Yeah,
is that because people haven't paid yet? Or what's the reason for that?
the drain funds are not final yet. Those are still in the midst of being closed out. So I don't have, those numbers are not final.
So there could be more revenue that's come in.
Potentially that we might have some revenue accruals that need to happen at this point.
Okay.
okay. So we'll move on to items for consideration. The first one being WM 20/11-110 to approve payment of the accounts payable of $7,982,616.19, covering the period of October 23rd, 2020 through November 5th, 2020 for checks as presented by the county clerk.
So
So
moved.
Moved. Hovey Wright.
Any questions or comments on that? Zach?
No comment.
All right, then we'll vote on that. Kathy, roll call, please.
Mr. Laring, I didn't quite get that. Was that a yes?
Yes.
Thank you. Commissioner Mahoney,
Yes.
Commissioner Nash,
Yes.
Commissioner Snyder, Commissioner Wilkins,
Yes.
Commissioner Foster,
Yes.
Commissioner Hovey Wright,
Yes.
Chairman Hughes,
Yes.
Commissioner Skolnick.
Yes. Just a minute. Okay, that item passes. The next item is WM 20/11-111, to authorize Muskegon County to continue membership with the Michigan Transit Pool for Matt's auto liability insurance coverage for policy period 12/1/2020 through 11/30/2021, with an annual contribution of $110,956 paid in quarterly installments.
So move.
Support.
Okay, any questions on that?
Bob, I'd like to know if we got any quotes on that or if this is just a continuation of what we had before.
Kristen is the expert on this. Kristen, you have to unmute.
Hi, this is Kristen. Can you hear me?
Yes.
We can.
Okay, great. Yes, this is a continuation. We did look for other quotes, but this is such a unique type of coverage that we didn't have anyone else that was able to bid on it.
Thank you.
Hey, anybody else? No one else? Kathy, roll call on this, please, too.
Commissioner Mahoney,
Yes.
Commissioner Nash,
Yes.
Commissioner Wilkins,
yes,
Commissioner Foster,
Yes.
Commissioner Hovey Wright,
Yes.
Chairman Hughes,
Yes.
Commissioner Laring,
Yes.
Commissioner Skolnick.
Yes. All right, that also passes the Ways and Means Committee. The next item is WM 20/11-112, to authorize Human Resources to proceed with the plan provision changes required by MERS effective January 1st, 2021.
So moved.
Support.
It's been moved and supported. Kristen, do you want to just give us a quick overview of this, please?
Sure. Kristen Wade, Human Resources Director. This is a requirement of MERS. It's a change that MERS is making to their definition of how they define a month of pension service credit. So currently the definition is for an employee to work 10 6-hour days in a calendar month to receive pension credit for that month. They are changing their definition effective January 1st to 60 hours per month instead of 10 6-hour days. So will not affect the way our employees qualify or don't qualify, but just a definition change that we're required to have board approval on.
Okay, and
Mr. Chair, can I ask a question?
yes, please.
Kristen, I'm wondering how that affects salaried personnel where they're not necessarily back at their time. I understand there's no change, but how competed with salaried personnel?
The salary personnel are still, we still equate those to paid time during the month. So we're still able to equate that to how many hours per month that they're actually paid for. So it will not affect any salary employees at all.
Okay, thank you.
Kristen, and didn't you say that part-time employees are not covered by the pension plan anyway?
Hourly employees. Full-time employees are covered and part-time employees are covered, but hourly employees are not covered, and that will not change.
Okay. All right. Kathy, another roll call.
Thank you.
Commissioner Nash,
Yes.
Oh,
Commissioner Snyder. I don't think
Yes.
he's on yet. Oh, thank you.
Amen.
Commissioner Wilkins,
yes,
Commissioner Foster,
Yes.
Commissioner Hovey Wright,
Yes.
Chairman Hughes,
Yes.
Commissioner Laring,
Yes.
Commissioner Mahoney,
Yes.
Commissioner Skolnick.
Yes. And that motion passes this committee. The next item is W120/11-113 to approve the repayment of $106,064.89 in unexpended Cdbg, that's Central District Block Grant Housing Grant Funds from prior years to the state of Michigan, MEDC, and amend the budget accordingly.
So move.
Support.
We have a motion and support, and I thought Tim Burgess was going to be here, and I don't see him.
Yeah, he's having difficulty getting signed on. He's tried his cell phone and it's not working for him. I can try to answer any questions regarding this particular motion.
I have a question.
Yes.
Yeah, I mean, I know I used to be on that committee, so usually we're really, stretched for funds. And I'm surprised that they didn't spend like almost 50,000 in the last, in 16 and 19. Any reason for that? Did people
That
return
question-
it or?
I can't specifically answer that question. I know that the first 2 years that are listed on the motion, the time period has passed that we can no longer, we have to send those funds back that were not expended. The last year, the 55,000 for 2020, we theoretically have until June of next year to spend those funds. However, there's a process that you have to go through to be able to spend those funds that require you developing a plan for using them, that this has to be submitted to the state. Then you have to assign a program administrator, and then the money has to get spent all within that year. And given that we're already in mid-November and none of those actions have been occurring or have started, it's not likely that we'll be able to spend all that, and we would have to return those funds by, for next year anyway. I know that Tim had communicated to me in an earlier email that they have not been getting requests for, it has to be qualified housing rehab projects in non-entitlement communities. They have not been getting requests for those in recent years, but to answer your specific question and see if he's gotten on yet.
Well,
I would,
that particular area, I know the senior resources, we're funding a lot of home rehab, so that may be a big piece of that, both in Muskegon and the Heights and other areas. Yeah,
that's possible. I don't know what the actual qualification, you have to have certain qualification criteria, the homeowners do, and they have to be in non-entitlement communities. I don't have all the details of that. I can try to make sure that he can get on for the full board meeting to specifically answer those questions, but that's to the extent I know as of right now.
I can check in and give you an indication that we have not had requests to do that. And I think that Bob Skolnick can probably confirm that.
Yeah, the thing is that we probably haven't had requests because nobody knows there's money available. So this is like, I think it's kind of a marketing, there was no marketing of it. So why would people, if you don't know about it, seems it's a shame to send that back.
it is.
And I
Well,
think part of that is because it goes to non-entitlement communities, and the Heights and the city of Muskegon are entitlement communities. So that's why this particular money does not go to either one of those.
Well, and we've got to make it, I think it's incumbent upon us, because I, as a board member of the land bank, was unaware of the fact that it had to go to non-entitlement communities. And I'm sure that there are places out there that can use the funds.
Yeah.
I agree.
Yeah, that's what I'd like to see us amend this to keep the funds that we have available until June and work to expend those funds, because it's not a good look when we get these grants and we have to send this money back. And now we're talking about doing 2 or 3 different years. I think we need to do what we can to expend those last funds. We have no recourse for the other funds, but I'd like to see us make an amendment to only do the first couple of years and keep that like last year's of funds. See if we can expedite those being spent on some, I think, community support, because I think that's the information, is that it just hasn't been known. And I'm sure there's someone out there that can need that support.
Well, especially now.
Beth,
People
didn't,
Exactly.
working. Yeah.
didn't that cover, that was like 4 years, and almost half of the money was the last year.
Right.
And I
It-
think it
could
looks
see
like the
on the-
last year is not right. It's 14, 15, 16, 17. Where's 18 and 19?
Those
They
are
didn't
years,
have unspent money. Yeah.
it's
I
based
know, but
on
we're
years.
missing a year. We're missing 18. 2018, it's not on there.
Yeah, it's on
So I
years where
think-
we received over 35,000, and in those other years, we did not receive over 35,000.
I see.
So it's
Okay,
just-
thank you.
It's the years
So
that we,
17 and 18 would have, or 18 and 19 would have been, see, it should be 18 and 19, not 19 and 20. Because it's 14, 15, 16, 17. It should be 18 and 19, not 19 and 20.
yes, theoretically, we have the 19 and 20, the July through June of 19 and 20, the 55,000. We have until next June to spend that. So if you want to exclude that year,
Yes.
the new total would be $50,790.28. The other years that are listed on there, the time has expired. We no longer can spend those funds, so we have to send those back.
Beth, we could make this decision at the full board meeting when we have Tony or Tim on the call.
Well,
Who's
we could do that.
That's if we get them on the call. We've been trying to get them on the call and it hasn't happened. And I'd hate
Why
to
don't-
see us send these funds back in error.
Well, I
Why don't we
agree.
table this until the full board then?
Could do that
Okay.
Thursday.
I'll second
Well,
the
yeah,
motion.
So do you want me to bring it back under the administrator's report at full board?
Yeah, why don't you do that?
Yeah, it's Thursday. This Thursday, yeah.
Right.
But I would agree with Charles that we need to try to get that last 55,000 spent.
Yeah, I mean, it's silly to give it back. That could,
Who's responsible for CDBG? Is that
It's handled by, through
Tim?
Timber. Yes.
Burgess?
okay, so would someone want to make a motion to table this?
Susie already did, Bob,
I made a motion, Bob.
Okay, so,
and John seconded it.
okay, so there's a motion to table. We'll just vote on that. Kathy, roll call on the table motion, please.
we need a timeline.
By the full board
The
Thursday.
full board, yeah.
Till Thursday.
Commissioner Mahoney,
Yes.
Commissioner Nash,
Yes.
Commissioner Wilkins,
Yes.
Commissioner Snyder,
Yes.
Commissioner Foster,
Yes,
Commissioner Hovey Wright,
Yes.
Chairman Hughes,
Yes.
Commissioner Laring,
Oh,
Commissioner Skolnick.
Yes. Okay, so that's tabled. The final item is WM 20/11-114 to enlist the services of a temporary consultant to provide FAA Part 139 documentation airfield operations review, staff training, and staff supervision until an airport manager or airport management firm is hired to provide those services for the county at
So moved.
a not to exceed contract cost of $20,000 and amend the budget accordingly. Permanent management is expected to be in place by January 2021.
So moved.
All right, we have,
Second.
did we have support?
Support.
Yes.
Okay. Is Bob Lukens here?
Yes, he should be.
Yes, I am, Commissioners. Good afternoon, Bob Lukens, Community Development Director. As you know, some time ago, actually last year, our airport manager resigned. Following that, we attempted to find an airport manager, but we had some difficulty in locating qualified individuals that would potentially relocate to Muskegon to accept the position. Later on in February of this year, we lost our operations supervisor at the airport. He found another job and moved on. And then COVID struck. So it's been very difficult to find an airport manager or an ops supervisor with the experience that we need. And the airport, or I'm sorry, the FAA was concerned about that as we move into winter, this winter. So they have instructed us to find a temporary interim ops supervisor that would be able to lead the maintenance staff in snow removal operations and to get our training programs and training documentation in order for our annual inspections. So what this is asking is to bring in a temporary ops supervisor that has Part 139 experience to lead the staff through the winter and until we can enlist the services of an airport manager or an airport management firm. As you know, simultaneously, we are looking at the possibility of an airport manager or an airport management firm to operate the airport. So that all of that is progressing. I've had interviews with some management or manager candidates, and also we will be receiving the proposals for airport management firms. I think those are due December, in early December, I believe. Or I'm sorry, I think it's November 30th that those are due. So we'll be able to review those and compare the cost of a manager to an airport management firm, the costs and benefits actually of an airport manager compared to an airport management firm. And we plan to bring that back to you in January to make that decision, or actually December to make that decision.
Bob, I have a question.
Yes.
Yes, ma'am.
Is this, do you have somebody that you're going to hire, or is this asking to go look for somebody? I don't understand it.
Actually, the FAA and MDOT Aeronautics have suggested a number of qualified individuals that we can engage with to bring on a temporary basis. So I've been in talks with several of those individuals already.
Okay, thank you.
Okay, any other questions? Okay, Kathy, roll call, please.
Can you hear me right now? This is Kathy.
Now we can.
Okay. Commissioner Nash,
Yes.
Commissioner Snyder,
Yes.
Commissioner Wilkins,
Yes.
Commissioner Foster,
Yes.
Commissioner Lee Wright,
Yes.
Chairman Hughes,
Yes.
Commissioner Laring,
Yes.
Commissioner Mahoney,
Yes.
Commissioner Skolnick.
Yes. Okay. That passed. I just have Beth, the fact that we're missing an airport manager, did that help the budget?
Well, it did to some extent, yes. Because we haven't expended those dollars. Bob might be able to tell you how, if we did anything else to offset it, that we had. I don't think that we added costs for any contractual services.
That's correct. At this time, we've not added any additional costs.
We just did.
Okay.
Yeah.
Yes.
That is correct.
Okay, thank you. Moving on to old business. Is there any old business to come before the Ways and Means Committee today?
So Commissioner Skolnick, we have a couple staff directors that would need to address the board right now, if that is your pleasure, unless any other board members have comments first.
I remember you told me that now. Okay, who do you want to go first?
So first, Director Kathy Moore, Public Health Director, wanted to give us a brief COVID-19 update for the county. And she's also going to give another update on Thursday. I don't know if it's going to change much, but so Kathy.
So I can almost guarantee it's going to change much. Not that I'm rooting for a change, it's just changing so fast. So our, if you look at the slide, the number of active cases is in the red. We are now up Muskegon County to 5,170 individuals in our county that have been diagnosed with COVID-19 to date. Really trying to show on the graph here that a lot of these cases, more than half of these cases came in over the last month compared to, all the cases since March. Next slide, please. Just again to highlight the heavy load, just all of a sudden, beginning with March, the highest number of positive cases that we received in one day was 29, and that was on May 17th. And then we did not know, those were the good old days, and we had numbers less than that every day until October 19th, where we reached our highest number again at 29. And then, as you see, every day after that, we have superseded our highest number of cases. We've almost reached 10 times that amount in one day at 271. Next, please. The hospitalizations, Muskegon County, these are the first chart is the regional hospitals, or all hospitals where most of our Muskegon County residents land. And these are their statistics and bed capacity as of yesterday. And then below, the chart below is the last 3 days of the hospital status at Mercy Health Sherman campus, which is our largest hospital. And just looking at capacity as of today, 125 adults in the hospital, 18 are ICU, 14 are now on the ventilator, and 2 were transferred out. And so far today, 68 individuals presented themselves to the emergency department with COVID-like symptoms. The hospital stats, of course, does not include exclusively Muskegon County residents, because we do have other residents from surrounding counties that's also in the hospital. Final slide. And then the final slide is really a comparison of our current prison facilities. This is almost a 1 week comparison. The chart at the bottom is November 10th, and then the chart at the top is as of November 16th. The EC Brooks Correctional, where they had gone for many, many months with no cases, no positive cases, they are starting to experience positive cases as well. They've tested 1,194 inmates. 432 have been diagnosed as positive. 409 of those 432 are active, and that's because these are recent diagnoses. For Muskegon Correctional across the street there, they've tested 1,401 inmates. 1,113 has been diagnosed as positive. Many of those were diagnosed over a month ago, so they have the recent diagnosis and active cases of 110. The difference over here in the brown, on the brown chart, a week ago, there were 13 employees diagnosed at EC Brooks as positive. As of yesterday, that number has increased to 42, and Muskegon Correctional from 46 to 65. I'm in a room that, so those cases, again, are considered Muskegon County cases if those employees are Muskegon County residents. Some of their employees are not Muskegon County residents as well, but these are their stats. I really wanted to highlight our deaths, which just hit a horrible number over the weekend. Last week we reported 91 deaths, Muskegon County. Today we have 124 deaths. That is 33 individuals that died since last week, and 16 of those deaths occurred over the weekend. So we're still catching up with death certificate and information like that. And that concludes my report.
Kathy, I have a question. Could you go back to the slide right before this? I don't know who's controlling. Yeah. You see up at the top, it says Hackley and Lakeshore. And
yeah.
There's zero. Why is there a percentage for, oh, it's 42% without any COVID patients?
Yes, so they have, so their hospital is still occupied even though they don't have COVID patients, yes.
Okay. And do you, this surge that's going on, does anybody have any guess like when this will taper off?
No, we are afraid that the holidays may keep it going. We have Thanksgiving, Christmas, and New Year's, and so mid-January, we'd give it 14 quarantine days after New Year's, mid-January possibly. With the recent emergency orders from MDHHS, they are giving it 3 weeks and then they'll probably review it again. It is possible that after 3 weeks, the numbers will go down. I don't necessarily think it will though.
Yes, Marcia?
Yeah, Kathy, our positivity rate, the last I heard, was about 20%, which is exceedingly high. And yet our emergency order only related to access to services at the county. Is there anything else you think we should be doing for the county to tamp down that number? Any other?
We've looked at a lot of things, and with hospital capacity, hospital is also challenged with staffing. The long-term care facilities and nursing homes, they've been hit really hard, and they are very challenged with staffing capacity. So to even consider, closing things beyond a certain point, you're putting the staff, in a position where they may not be able to report to work. And we absolutely need as many of those staff that are healthy and able to report to work at the hospitals, the long-term care facilities, as well as the group homes, adult adult foster care and group homes. It's really hard to go beyond what's already done because there's still a need for groceries and things like that.
Anybody else? Kathy, thank you for putting I think Muskegon County has been blessed by having you as the health department director. We had a pretty good face on this whole issue, thanks to you.
Thank you. And I'd like to thank my fellow directors and elected officials. Mark Eisenbarth had put out a request for assistance with contact tracing. And Kristen Barnhill is going to help coordinate that. But I think she reported we might have 8 to 10 individuals who will be assisting public health over the next few months to contact trace. And we do have the grant dollars that will support that staffing. And I'm just, we're looking for a way to streamline and make it a little more electronic, but very grateful for the assistance. Thank you.
Is this paid work, right?
Yes, the grant dollars will allow us to pay them at their whatever their salary is, their current salary. One of the stipulations of the grant dollars is that we can't pay for indirect time, so we can't pay for the holidays, sick, vacation, personal days, but any direct work, yes.
So is that available to people in the community that are maybe needing to earn some cash?
We would like to
done by phone.
We would like to start with our county, our fellow county employees, because I think we have more HIPAA confidentiality control. But we also are looking at a contract via Good Temps to assist with the schools, because that is, if we're going to keep the schools open, we have to also help contact trace within those districts. So we will be looking at additional positions through Good Temps.
Okay, Kathy, thank you.
Thank you.
Was there another director?
Yes, Sandra Vanderhyde, our Circuit Family Court Administrator, is going to update the board on recent developments with regard to the courts, where they're at in their phase of reopening. Sandra? Are you there, Sandra?
I am. Sorry, this is Sandra Vanderhyde, Circuit Family Court Administrator. Thank you for allowing me to speak for just a few minutes today. Prior to the order that was entered by MDHHS on Sunday, we had been notified that we would only have to go backwards another phase. We had to go backwards a few weeks ago to phase 2. We were told, though, that we would only have to go back to phase 1 if there was a statewide shutdown. After the MDHHS order was entered on Sunday, in the afternoon yesterday, the state court administrator released a new memorandum that says if our positivity rate in our community is higher than 15%, that we will have to go backwards to phase 1. In the process of drafting our phase 1 LAO, it actually does not change that much for the courts, as we are already doing the majority of hearings and work remotely. But it does say that now we are even more limited to what hearings we can do in person. Defendants still do have a statutory right in some situations to be in person, so those are the exceptions. But otherwise, we are going to be doing everything remotely and the majority of hearings remotely. Any questions?
Any questions? I think you're off the hook, Sandra.
All right, thank you for your time.
Okay, thank you. Thanks for your report. Okay, that's it for old business. I guess we'll move to new business. Does anyone have any new business with Ways and Means?
Commissioner Bob.
Yes, Commissioner Ken.
There are two things I think we ought to do as a board. First of all, we need to have some sort of resolution honoring all the healthcare workers and anyone involved in the healthcare system at this point, based on all of their efforts trying to keep Muskegon County healthy. I mean, it's unbelievable the stress on the folks in the hospital and other healthcare givers. So I would suggest we come up with a resolution covering that somehow. Second thing,
I'll have somebody work on that, Ken.
I'd
We
appreciate
presented
it.
at the full board on Thursday.
Yes.
Mhm.
The second thing is,
We'll work on that. Thank you.
the second resolution, I think we need to honor the clerk and all of the other clerks in the county, in addition to all the election workers who had to come up with new plans on how to handle all of the absentee ballots that came in this time. They did an excellent job, got us through the situation without any hiccups, or very few hiccups. So those folks did a great job.
Now, the vote in Muskegon County is over and certified. Is that correct?
That is
That's
correct.
correct. I'd like to add to what Ken said too. Not only did they do a good job with all the absentee votes, there was quite a challenge at the polls themselves
Right.
with social distancing and everything, and they did an excellent job there too.
Yeah. Should we exclude the Montague clerk?
Of course.
I'll work on that too, Ken. Thank you very much. Excellent idea.
Okay. Any other, that's it for new business, public comment. Anyone on this, anyone in the audience would like to speak? Now's your chance. There's a raise your hand. No, I'm looking. I don't see anybody. Susie, do you see anybody?
No hands raised, Bob.
No, I don't see any hands raised, but I'm not exactly sure that they can do that on this. I don't see, I don't, but I certainly don't see anybody. So if there is anybody, I'd ask them to speak up.
Okay, I can see the raised hand. There's a button on my
Okay.
screen. Yeah.
All right, because I
Yes,
don't
they are
see
able to
anybody
do
with
that.
it. Okay, I don't see it at all then.
Okay. Final board comments. Got one last crack at us here. Anybody? Charles?
I'll make a motion, we adjourn.
I'll support that.
Okay. All those in favor say aye.
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 Opposed? We're adjourned. Thank you very much. See you Thursday.
Thank you, Bob.
Okay.